Could red light therapy be the most underrated biohack, even better than cold plunge or plenty of the other things that we see on social media? Welcome to Sammillerscience, where you're joining me nearly 2 decades into my personal journey to bridge the gap between macros, metabolism, muscle, and medicine. If you're joining me, thanks for trusting me to elevate your health and realize your true potential. Each week and inside every episode, I'll be sharing methods and models from my coaching journey and my personal experience, as well as the science that you need to achieve whatever specific goals you're working on in your life. Let's jump in to today's show. You've probably heard of red light therapy, and it's been thrown around a lot online, and it seems a little woo-woo at first, something that's easy to write off. But when we think about the fact that light has powerful effects, we see this with sunlight. Sunlight is the primary regulator of our circadian rhythms. It induces vitamin D synthesis and nitric oxide synthesis, and can even have beneficial effects on our heart. We know that the same blue light spectrums in the evening can wreck our sleep. So with that knowledge, red light therapy may seem like something that we can actually get behind when we think about all of the other different ways that light exposure can impact our health. And even though more research needs to be done, there are studies that already reveal the positive effects of red light therapy, ranging from increasing skin health to hair regrowth, and even supporting that hair vitality in instances of baldness. We've seen improvements in fertility in men's health and improving exercise recovery and possibly even exercise performance. So today we're talking about red light therapy and the spectrum of health effects that it has, as well as how red light therapy actually works. In terms of the history of red light therapy, it's actually been around for a while. It was first discovered in 1967 by Endre Wester at a university in Hungary. He was actually attempting to use a low-level ruby laser, or a form of red light, to eliminate tumors in rats that he was studying. Although he didn't actually get rid of the tumors, what he noticed was there was actually significant hair regrowth and increased wound healing in the rats that he was working with, and then the field of research into red light therapy was born. Up until the year 2016, it was known as low-level laser therapy, not red light therapy, but no one actually knew what the term low-level laser therapy meant, and it was found that LEDs with similar light parameters to the original lasers were just as effective. So the official name of the field was changed to photobiomodulation. Again, that's a mouthful and not necessarily easier than low-level laser therapy. For today's episode, I'm going to refer to it as red light therapy for the remainder of the podcast, because that's what it's more popularly known as on social media. But if you ever wanted to look into some studies on the subject, you'd look under photobiomodulation. If you just do a quick search through scholarly publications on photobiomodulation, you might think, oh my God, what doesn't this stuff do? There's so many potential benefits. Up until about 2010 to 2015, the medical field viewed red light therapy as complete snake oil. There was mainly this skepticism due to lack of understanding of how it worked. And there was also a lack of standardization in things like the actual light sources used and illumination parameters. So what I mean by that is things like wavelength, power density, and other factors can actually impact the efficacy of the treatment. So a number of studies were being done, but without the prior knowledge of exactly what types of lights to use, what wavelengths were effective, and how to actually narrow down the focus of the study. Even though some of the studies were finding positive results, others found many negative results because they weren't using the proper parameters of treatment when it came to these red light therapy sources. But once those things started to become standardized, there were significantly more positive effects that were being seen with red light therapy. The real acceptance of the field as a whole came when the actual mechanisms of action of how it was working were identified. And since those mechanisms have been identified, we've seen a ton of different health organizations dedicating significant funds and time to researching this topic. So when it comes to red light therapy, you're probably thinking, how does this stuff actually work? It involves shining a red light with very specific parameters onto the area of interest on the body. And it sounds like it could be a little bit of a gimmick, but some studies do actually insert catheters into arteries and deliver red light directly to those sources, but obviously that's not something we can do at home outside of a medical facility. The first mechanism of how this red light therapy works involves our mitochondria. They are frequently known, as you've probably heard in high school biology, the powerhouse of the cell. Mitochondria are used to generate ATP, which is the energy currency that we need to stay alive. We also know that when the health of the mitochondria suffer, or we have dysfunctional mitochondria, there are certain diseases that can take hold, and this decreases the function of whatever tissue that the mitochondria is in. Dysfunctional mitochondria in skin leads to skin aging, and in testicular health. It may lead to lower testosterone production. When we see those mitochondrial impairments in hair follicle cells, it may lead to baldness. So improving the health of the mitochondria effectively slows down the aging process and may even reverse biological age to some degree. One of the little pieces of the interior of our mitochondria is actually sensitive to photons of light. There's certain spectrums of light, and that's really what we're paying attention to here when we talk about the research. When these photons hit that enzyme complex within the mitochondria in our cells, an inhibitory molecule is removed, which allows cellular respiration to function significantly more efficiently, ultimately resulting in more ATP production. So there's another way that it works as well. This one is going to have a little more science-heavy terms to it, but if you understand the mitochondrial piece, that is a big player. But basically, inside our body, we have light-sensitive ion channels. These can be activated, which allow calcium to enter the cell. After the initial photon absorption, a cascade of a number of different signals are activated, which leads to this activation, or think of like turning on transcription factors, which are the molecules that actually cause our DNA to create proteins. Now, these transcription factors can lead to increased expression of genes related to protein synthesis, cell migration and proliferation, anti-inflammatory signaling, which is a good thing, anti-apoptotic proteins, and antioxidant enzymes. Stem cells and progenitor cells appear to be particularly susceptible to red light therapy, which is super interesting given all the research we're seeing into stem cells. This makes our mitochondria work better and also significantly changes our gene expression in a positive manner. That's the TLDR on how red light therapy is helping. So when we think in terms of the benefits and what the research seems to demonstrate, we have some studies that actually reveal how it's helping us from a health perspective. Since a lot of you guys are either health enthusiasts or coaches or have a fitness oriented background, we'll talk about the exercise and performance data first. There was a 2021 review paper that included the results of 25 positive human studies. There were improvements in sports performance and recovery. This dated back to 2015, and there were 22 animal studies. So a fair amount of human data and animal data as well. There's been some conflicting negative data, but it occurred mostly prior to 2015 because there was no standardization of light treatment. So while it is a criticism, it's not really a fair criticism. One study with 6 subjects showed negative results. We threw that out for the purposes of this particular podcast and analysis, but the weight of evidence so far indicates very positive results in terms of health. Now, before we dive into the first study, you should know a couple things. The first is a biomarker called creatine kinase, or CK, which is a measure of muscle damage really from any source. But in this context, it's measuring damage in response to exercise. And the second is a measure of energy that some of these studies used called joules. One study might deliver 10 joules, the other might deliver 50. So the first study used 3 different doses of 10, 30, and 50 joules in a placebo. The subjects did a leg resistance training workout to eccentric failure, and red light therapy was done immediately before the exercise session. Over the next 4 days, the researchers measured maximal voluntary contraction ability. They also looked at CK levels in the blood and subjective levels of delayed onset muscle soreness via questionnaire in the subjects at 1 hour and then each day after that for up to 4 days. The 10 and 30 joule condition showed higher maximal voluntary contraction ability at all time points measured, even 1 hour after exercise. As far as the delayed onset muscle soreness, the 10 joule and 30 joule conditions had significantly decreased delayed onset muscle soreness after 24 hours, but the 50 joule condition barely experienced any delayed onset muscle soreness at all. CK levels were lower in all red light therapy conditions compared to placebo. This study concluded that 30 joules had the biggest effects. The other study was done on 28 male soccer players with a near identical study design, just to be able to replicate it, except they also measured interleukin-6, which is a marker of inflammation. So they measured that in addition to the previous markers. Maximal voluntary contraction was improved after 1 hour compared to placebo, and creatine kinase and interleukin-6 were significantly reduced in all conditions, except best results were actually in the 50 joule group this time. But in this study, delayed onset muscle soreness was not affected, even though power output was a lot better in the red light therapy group. The next study that they pulled in was rugby players. And so in an actual sprint field test, they looked at this over 3 weeks, 1 sprint field test per week. They only had 1 light condition pre-sprint, which was 30 joules, and a placebo group. They took the average time of the sprints, best time of the sprints, and a fatigue index that they obtained from the sprint test. They also measured blood lactate levels at 3, 10, 30, and 60 minutes after the test. Athletes' perceived fatigue was also assessed through a questionnaire, and what they found was the red light therapy significantly improved both best and average sprint times, as well as the athlete's perceived exhaustion. Blood lactate levels also didn't rise nearly as much in the red light therapy treatment group, and they seemed to clear that lactate faster as well. One final study on football players. Now, what's interesting is you can see there's a range of sports here and potential applications, but the study was looking for the best power output from the lights. So they had 4 different conditions, but this was in terms of milliwatts this time instead of joules. So 100 milliwatts, 200 milliwatts, 400 milliwatts, and then they also had a placebo group. Treatments were done again directly pre-exercise, and they measured a lot in this study. So they had maximal isometric contraction, delayed onset muscle soreness, creatine kinase, lactate dehydrogenase, interleukin-1 beta, 6, and tumor necrosis factor alpha. And they also measured oxidative stress. These were gathered before the red light therapy intervention to establish a baseline, as well as 1 minute after, and then at a certain time point from 1 hour to 96 hours after they went through the exercise. All of the markers of inflammation, as well as all of the markers of oxidative stress, had improvements, as well as higher muscle contraction ability and less delayed onset muscle soreness. Talk about performance enhancement. But the best results were seen in the 100 milliwatt group. Remember, they also tested 200 milliwatts and 400. So it doesn't always mean that more is better. This presents a bit of a unique challenge for us at home who want to use it for exercise and performance and recovery, because it can be hard to calculate the right dose, so to speak. We'll get into different ways to have this red light therapy application and what to look for when you're shopping in a bit. But when it comes to sports performance and recovery, there's plenty of really solid studies, 21 more studies in that review paper that shows results in humans. So this definitely can be a very viable addition to your performance and recovery strategy. If you do a search yourself, you're bound to find some negative results. Just remember, this could have been from the time period prior to red light standardization or the identification of what the actual light parameters were, which of course is going to make it look really bogus. One of the other areas that we see positive effects from red light therapy, besides just exercise performance, is going to be joint health. Joint health and different forms of arthritis is an area where red light therapy has substantial benefit. Kind of in a similar vein to exercise, we need our joints to be functioning well, but there's good evidence showing reduction in even things like osteoarthritis symptoms, which is more severe than just the occasional joint pain. And we also see increased collagen content in the joints of osteoarthritis patients who have undergone red light therapy. A few studies also looked at rheumatoid arthritis, and while it wasn't a totally dramatic result, the red light therapy treatment group did see short-term relief in pain and morning stiffness in those with the condition. Now, beyond joint health, we can also see red light therapy benefits in terms of male fertility. We have a number of different positive human studies on this. Red light therapy treatment improved motility, viability, and the survival of sperm in men who used 4 or 6 joules of red light therapy for both 45 and 60 minutes. And they're basically shining the red light therapy on their testicles exactly as you would think. Now, the other benefits outside of just fertility and joint health would be wound healing and injury recovery. It seems it could be a very powerful tool for increasing wound healing and injury recovery. And the lion's share of studies here are done on animals because it's not really ethical to make a gash in a human's leg and then test the time that it takes to heal. So they would need to basically do observational data or people who are already using red light therapy to heal their injuries. But there's potential applications in terms of burn wounds, ulcers of many kind, and maybe even fractures. Many studies need to be done here, but it's definitely a promising start. Brain health and brain disorders is another powerful application of red light therapy. Transcranial red light therapy, done by shining the light as close to the cranium as possible, has been shown to enhance the metabolic capacity of neurons, and it can stimulate anti-inflammatory and anti-apoptotic and antioxidant responses, as well as neurogenesis and synaptogenesis. So far, it's been shown as a possible therapeutic role in disorders like Parkinson's and Alzheimer's, but also even helping with things like stroke, brain trauma, and depression. Alzheimer's actually has a couple human studies that show significant improvements in sleep quality, mood states, EEG patterns, and improved cognitive functioning, especially in terms of memory and attention. One study did a blood luminescence where they inserted an arterial catheter to deliver red light therapy directly into the arteries. This had the most powerful effect on reducing scores of dementia. And also for Parkinson's, there's currently only one study here, but this is another potential case for working against that neurological decline. There's only been one study related to Parkinson's, but there were significant motor and cognitive improvements in Parkinson's disease patients after only 2 weeks of transcranial red light therapy. We also see similar improvements in function and reduced neuroinflammation, in traumatic brain injury as well. Hair regrowth is another topic of interest, especially from an anti-aging perspective and just the health and beauty space. One of the first reports used the HairMax laser comb, which is a 655 nanometer laser in a double-blind, sham-controlled, multi-center 26-week trial with 110 randomized males who reported male pattern baldness symptoms. Patients were treated for 15 minutes 3 times per week for 26 weeks. The 63 subjects who received active red light therapy showed a mean increase in hair density of about plus or minus 17.3 hairs on their head. We also saw that the people with placebo had a decrease in hair density. So that's kind of a cool RCT. There's another study on hair regrowth that compared red light therapy to minoxidil, which is a popular topical treatment. And the combination group of red light therapy with minoxidil had the best results. And they actually came the fastest. At around 2 months, they started seeing improvements compared to 4 months with the 2 solo therapies, which would be red light therapy alone or minoxidil alone. And red light therapy did lead to improvements more than minoxidil, but it wasn't statistically significant in terms of the comparison of those two things. But using them synergistically really led to the best results with hair regrowth. One of the most popular things you'll see online right now is red light therapy masks and red light therapy for skin health. There's a reasonable body of clinical trial evidence to support the role of red light therapy as a safe and effective method of skin rejuvenation. Many studies have seen decreases in facial rhytids, which is basically a fancy term for fine facial lines and creases, the things that come before wrinkles essentially, and facial dyschromonomas, which are really just situations where people have a little bit of discoloration of their facial skin. It's also shown good promise for treating acne or inflammatory acne lesions. There's some other applications in the literature, but the data isn't really strong enough in terms of the number of studies or quality to give them mention just yet when it comes to skin health, but be on the lookout in the coming years for significantly more research on red light therapy. When it comes to deploying red light therapy at home, obviously this can seem like a tricky question and a little bit of a dilemma because some of these studies are taking place in a clinical setting and we certainly don't have the ability to take a catheter and shine red light into our bodies. And you can't just go and buy a random red light bulb at Target and expect to have benefits. So the red light therapy parameters that you're looking for if you're going to do this at home are wavelengths of light at 650 and or 850 nanometers, delivering an irradiance of at least 100 milliwatts. As far as getting the right dose, this is a big question as well, in addition to the strength of the light. Now, you could sit there and do complex calculations of exactly how many joules you're getting, but it's probably not worth it. Just know that the light intensity falls off exponentially as you move away from the light source. So if you have a certain distance and you move twice the distance away from the light source, the intensity actually falls off by 4 times the amount of intensity, or it'd be 4 times less intensity. So if you move 4 times the distance away from the light, it'll be 16 times less intense. So you want to be as close to the light as possible for around 20 to 60 minutes. If you're specifically doing it for exercise recovery and performance, it seems that doing it pre-workout is going to be better than doing it post-workout based on the data that we have available at the time of this recording. Even though red light therapy has been around for nearly 60 years, it's often been questioned in terms of its legitimacy, when the reality is this could actually be one of the best biohacks that's out there today. It really only became accepted within the last 10 years, and we only have high quality human studies for a very small amount of time once they began to standardize the type of red light. Expect a ton more research in the next decade or so and more accessibility and popularity of these devices as they become more mainstream. If you learned something new about red light therapy today, if it's something you plan to try, if this changed your perspective on red light, or you just found the show to be entertaining, please share the show and drop a 5-star rating and review wherever you listen on any platform. You can also support the show by subscribing, and many listeners that find the show really do so based on your behavior. So when you share the show, when you rate and review the show, it allows like-minded listeners to find this content in our community. And I greatly appreciate it when you guys do that. Thanks so much for joining me today in this episode all about red light therapy and one of the more promising biohacks that's out there right now. I hope you guys enjoyed it, and I'll talk to you in the next episode.